Hello everyone, welcome to the Mental Health Minute. My name is Christy Stubbs and today we're going to be talking about borderline personality disorder. Borderline personality disorder is a pervasive pattern of instability of interpersonal relationships, self-image, and affects and marked impulsivity beginning in early adulthood as indicated by 5 or more of the following symptoms. Number 1, a frantic effort to avoid real or imagined abandonment. Most people will typically perceive that they're being abandoned, perceive that they're being rejected, and in turn, they will have a pattern of unstable and intense interpersonal relationships. These people are consistently and forever feeling abandoned and rejected. They're constantly feeling as though people don't love them, don't want to be around them, regardless if it is true or not. The third thing would be impulsivity, whether it's in spending, substance abuse, binging, reckless driving, or even sex. Their affective instability due to marked reactivity of mood can last anywhere from a few days to a few hours. There's inappropriate and intense anger and difficulty controlling anger. Identity disturbance is marked and persistent, unstable self-image, chronic feelings of emptiness, transient and stress-related paranoid ideation, and severe dissociative symptoms, recurrent suicidal behavior, gestures, or threats. Marsha Linehan, which is the developer of the dialectical behavior therapy for borderline personality disorder, has described people with borderline personality disorder being like people with third-degree burns over 90% of their bodies. Lacking emotional skin, they feel agony at the slightest touch or movement. Borderline personality disorder is prevalent and estimated between 1.6 and 5.9% of the population. The National Institute of Mental Health estimates approximately 18 million Americans suffer from borderline personality disorder every year. Completed suicide occurs in 8 to 10% of borderline individuals, and typically self-mutilative acts and suicidal threats or attempts are very common. These destructive acts are typically precipitated by threats of separation or rejection. And self-mutilation typically does occur to be able to bring relief from the inability to feel. Treatment for borderline personality disorder is dialectical behavior therapy typically. Drug therapy is also used to treat symptoms typically of depression, anxiety, sometimes impulsivity, but the combination of dialectical behavior therapy and drug therapy has proven to be very effective. So there's no longer a inability to be able to manage. It's very possible, and there is hope for borderline personality disorder. So that concludes today's discussion about borderline personality disorder, and we hope that you have learned something. Thank you.